Hello, everyone, and welcome to this month's Public Health Plus session titled Public Health Plus Social Justice, a very important topic at this point in time. My name is Michelle James, and I am the Senior Director of Alumni Engagement for the Rollins School of Public Health at Emory University in Atlanta, Georgia. Public health touches nearly every aspect of our world. It's true, and it's become even more true during the current COVID pandemic. It is at these intersections within our daily life, perhaps between public health and business, public health, communications, public health, and social justice, that we find the most potential to learn and grow, both as individuals and as a society. Our Public Health Plus series was created by the Rollins School of Public Health's Alumni Board Career Development Committee in partnership with our great friends at Orange Sparkle Ball to examine those spaces where public health intersects with other disciplines, to discuss that work and hopefully broaden our thinking. We are honored to have Brooke Silverthorn, my apologies, with us today to talk about her work at the intersection of law and public health through the Health Law Partnership, a civil clinic that combines the expertise of healthcare professionals and lawyers to improve the lives of low-income children and families on both an individual and a systemic scale. Megan Kennedy of Orange Sparkle Ball will facilitate our discussion, and together we will discuss the important role such organizations play in improving health outcomes by addressing social inequities. A little bit more about Brooke. Brooke is an assistant clinical professor in the Health Law Partnership Legal Services Clinic and is co-director of the Health Law Partnership, the civil clinic that is part of a medical legal partnership with Georgia State University, the Atlanta Legal Aid Society, and Children's Healthcare of Atlanta. In that clinic, Brooke teaches and supervises law students, medical students, and graduate students in the fields of social work, public health, and bioethics to represent clients and address their health-harming legal needs. Prior to joining the faculty at Georgia State, Brooke was the Director of Legal and Policy Advocacy at the National Association of Counsel for Children. In that role, she worked with attorneys, organizations, and government systems across the country to improve legal representation for children, parents, and agencies in child welfare court proceedings. She also served as a trainer and course instructor for child welfare trial skills and content training throughout the country. In 2010, she was certified as a child welfare law specialist and has served as a special assistant attorney general representing the Department of Family and Child Services in child protection litigation. So clearly, she has a lengthy experience in this area. Megan Kennedy is a good friend and founder of Orange Sparkle Ball, an innovation and impact consultancy. After graduating from the Rollins School of Public Health with a master's in public health and epidemiology and conducting HIV research at the Center for Disease Control and Prevention. Orange Sparkle Ball specializes in accelerating initiatives in the private and public sector, as well as with startups. Megan is a member of our Rollins School of Public Health Alumni Board and a mentor for many social entrepreneurs. She has taught at both Georgia Tech and the Centers for Disease Control and Prevention, and has served as a guest reviewer at Georgia Tech since 2007 and a judge for the Global Social Venture Competition, as well as the Industrial Design Society of America. Ladies, we are thrilled to have you with us today, and I very much look forward to this conversation. As I said earlier, it's a very important one. I think this is the perfect time to be having this conversation, and I hope that we will continue to have similar ones. But with that, I'll let you take it away.
So thank you very much, Michelle. I have to apologize to everyone. My Wi-Fi is going in and out. So if I go away, I hope my audio stays with you. But if I do, I'll try to come back very quickly. And with that, I will kick off the questions that Brooke and I have talked about. Also to let you know, Brooke is my best friend from high school. So we've known each other a very long time, full disclosure. So I'm hoping that will make for kind of a more entertaining conversation. Okay, Brooke, Can you tell us about yourself, kind of your story? I loved when we were prepping how you kind of talked through your story to get where you are, and in particular, kind of how you accidentally ended up in a position with health touch points that you maybe were not planning for.
Yeah, no, absolutely. Thank you, Megan. I'm thrilled to be here, and I'm thrilled to be doing this with you. So, yeah, so when we were talking before, I think I started out by saying, I feel like a little bit of an imposter in the public health world, where I currently find myself, because that was certainly not what I imagined for myself. But, I always had that social science interest. But I think, I was a little bit naive back when I was in school, because I really didn't appreciate at that time the connection between health and social science. I had a major in sociology in undergrad, and we certainly, at least at that time, I won't date myself, but we weren't talking a lot about, the intersection between, health and sociology. But I always knew I wanted to work with people. I was very interested in human behavior, attitudes, how people's life circumstances impacted them in, not just, their behavior, but sort of the trajectory of their lives. And, looking back now, I know that's, has a public health lens. So I think that my work, maybe has always touched public health without me really knowing that until, the last several years. It wasn't really until I got into legal practice where I began to experience that connection. I tend to be sort of a kinesthetic learner. And so, reading about things doesn't always, fully click for me. And so it was when I became, a lawyer in the field, working with children in the foster care system. As was mentioned, I represented the Department of Family and Children's Services in abuse and neglect proceedings for roughly 9 years. And what that basically means is that when parents are accused of abusing or neglecting a child and the agency gets involved, whether that's to remove a child from their home or just to sort of provide that oversight for the family to ensure that the child is safe. I was a lawyer that represented the agency in those court proceedings. And so, that was really the first time that I really started thinking about, the intersection of my work with health. Obviously, I, found myself representing a government agency that is, supposed to be protecting the health of children. But, at the same time, it also became pretty clear that just the way that defects gets involved impacts children's health, often negatively. Even when intervention is the absolute right thing to do to protect a particular child in a moment in time. When you think about removing a child from their family and their home, that's trauma, even when it's necessary. And so there's, sort of that connection between trauma, health outcomes, that really sort of got me interested in learning more about those connections.
So that is the perfect segue into, can you talk about your discovery of adverse childhood experiences and the research around that and social determinants of health? Because I thought when you talked to me about that, that's something that probably a lot of people on the webinar think about a lot. And I thought I loved how you talked about it.
Yeah, so maybe some people are familiar with the Adverse Childhood Experiences study. It's often referred to either as the ACE study, or some people just say ACEs. And so briefly, for those who aren't familiar with what it was a longitudinal study, it was a collaboration actually between the CDC and Kaiser Permanente, the health insurance company. And so they basically administered this 10-question survey to Kaiser Permanente members, about 17,000 of them. And they did this between 1995 and 1997. And the 10 questions related to common traumatic experiences in childhood. So for example, one of the questions might be, did you live in a household where there was substance abuse or where there was violence? Did you live with a parent who was depressed? Did you ever experience physical or emotional abuse? So nothing too shocking, right? When we think about, these questions, that makes sense. But the purpose of the study was to determine, whether there was a correlation between the number of ACEs, so the number of times, a person selected that, yes, that had happened to them, and their long-term health and well-being into adulthood. And so the hypothesis was that the more ACEs, the worse the health and well-being outcomes. And that hypothesis turned out to be correct. In fact, in 2019, the CDC found that 5 of the top 10 leading causes of death, including respiratory and heart disease, cancer, and suicide, are associated with ACEs. In fact, experiencing 4 or more ACEs is associated with a significantly increased risk for 7 of the 10 adult leading causes of death. So heart disease, stroke, cancer, diabetes, Alzheimer's, and then suicide, depression, substance abuse as well. So it's has some components to sort of behavioral and mental outcomes and well-being outcomes as well. It's interesting because, there's also correlation, as I mentioned, to the behavioral outcomes, as well as, folks, indicating that they engage in more risky behavior as a result of, or not, as a result of having experienced sort of these adverse childhood experiences. So in working, with the population of children who had, were involved with the Child Protection Agency, a lot of those children were likely to have experienced, at least one, but probably more ACEs. And obviously the study has its limitations, and there continues to be ongoing work related to ACEs. But for me, it really did make an impression, because I started thinking, this is 10 things, which we know is not an exhaustive list of all of the traumatic experiences that a child might have. But if we know some of what these are, and we know that if we can prevent them or protect against them, it may also prevent sort of these later health, impacts and these adverse health and well-being outcomes. And as I was a lawyer for the government agency who has legally intervened in this family, and therefore has a duty to provide services. So, maybe we work with the parents to address these and, potentially stop any further from happening, at least in the family setting. And then how can we work with children to protect against them, looking at those protective factors? Maybe we can really make an impact, even if it takes years or decades, to, a more large scale, sort of population level change, if we can really, identify people who are at risk of multiple ACEs at a younger age. So that was really sort of instrumental in me really making sort of the connection between, health and the work that I was doing.
And how do you think the sort of, I think about that as kind of going into systems thinking, and how do you think that impacted both your experience of being in the courtroom, but also kind of your decision to get into policy as well?
Yeah, so I mean, that's a great question. My decision to sort of get into policy, honestly, is because, it bothers me when I see issues that, are wrong. I'm sort of one of those people that I'm like, we need to fix this. We can't just, let this continue to happen. And the other side of that is that I tend to get bored pretty easily. And I need to have a lot going on. And so, looking at this issue from, the individual level, just at some point, wasn't enough for me. I certainly appreciate the story about, saving the starfish one at a time. And it makes a difference for that one, starfish that gets saved. I believe in that wholeheartedly. But I also, have this sociology type mindset, public health type mindset, if you will, where, when we know that these things are impacting, individuals, and it's not just the individual who's in front of me, who's my client, but it's, several individuals, across the country. Lawyers across the country have these individual clients, and as a collective, how can we learn from these individual experiences and make an impact that's larger than each, individual. So that was sort of, the impetus for that, because we know that, it also, when we make that sort of those broad scale changes, when we make those policy changes on a larger scale, on a systemic scale, we're also helping the individuals, and the individuals that will come behind, the folks that are before us at any given moment in time.
I think those of us with public health training can identify with that a lot, because that was one of the things that really made me fall in love with public health. Is you made a small change, but over the population, the impact is huge. So that's when we talked, one of the things that I was really interested in your policy work. The other thing that continues to fascinate me about how you approached your work is kind of your understanding of, I need to, you talked about being in the courtroom and then going into policy, and thinking that you were better if you were touching both of those things. You were a better lawyer. You're better in each of the individual areas if you were touching both of them, and then later into teaching as well. Can you talk about that balance, kind of your maybe dawning awareness that if you were spread across a lot of approaches, you might be more effective?
Yeah, it was a really interesting sort of discovery for me that when I first got into policy work, as was mentioned, I was a director of legal and policy advocacy at the National Association of Counsel for Children. And I intentionally took that job because I wanted to get more involved in policy advocacy and away from sort of that individual courtroom experience. Partly because I was frankly burned out with that, but also partly because I saw it as sort of the next iteration of my professional development. And interestingly, and what was so surprising to me was that after I was in that position for about 6 months, I would say, I had a discovery that I really missed being on the ground. I really missed sort of that individual ground, front lines type of work. And so I was very fortunate to have a boss who was supportive of my professional development. And I went to him and I said, I think I would be a better policy advocate. I think I would be a better trainer if I was able to devote some of my time to representing children and to being sort of in that individual role and continuing to do that while, concurrently with, my responsibilities related to policy and training. And so I feel like, and I recognize that that's not everybody's story, but I think, I mentioned I'm a kinesthetic learner. And so for me, it's really important for me to dive in and I learn more by doing. And so it really allowed me to, I think, be better, both for my individual clients, but also in the policy arena, to have both of those situations and both of those things going on in my life. And as I said, I get bored fairly easily as well, and it just helps my mind continue to churn when I have, those two different things going on.
I suspect that those of us, or those people who know either of us, are not going to be surprised that we were good friends as high school kids when we talk about getting bored easily. Can you talk about, so I was really fascinated by, you expanded your experience, and then you had this sort of light bulb moment when you started teaching, and how that then led you to your current role, because I've always known you to be a little bit of a risk taker, as am I. And I think you wove in the idea of taking chances, but also being sort of self-determined throughout in this story. And I think it's something that I get asked about all the time, making changes in your career and how you do that. And I think you talked about it eloquently.
Yeah. So
No pressure.
No. I should have recorded myself then and just play right now. I never saw myself as a teacher. What some of you may not know is Megan's mother and my father taught together. They taught 5th grade together. And I had a little bit of that, teacher's child rebellion related to school. I was a bit of an underachiever. I think probably a lot of my teachers would be shocked that I ended up where I did. And so, it was all very shocking to me, but I had an opportunity to teach a class at the University of Denver Law School when I was living out in Colorado. And I'm not one to turn down opportunities. I feel like when opportunities come your way, you owe it to yourself to at least explore them. And when I explored that opportunity and decided to take part in it, I had that light bulb moment where when I was working with law students, it sort of gave me back some of the excitement about being a lawyer again that I had lost through practice. And I was trying to figure out, how is it that I can make this my full-time job? And the law students really just reminded me every day of why I started the work that I started and really wanting to make an impact. And so it was interesting because when I made that decision that I needed to figure out how to do it full time, I sort of went in, with my guns blazing and, made it known to, a whole host of people of what, my goals were, what my desires were, tried to sort of bolster all of my experience, volunteered for a ridiculous amount of things just to, make those connections with people, to, for lack of a better term, pad my resume. Although, I don't want that to sound like it wasn't valuable work in saying that, because it was definitely very valuable. But I was, a finalist in many jobs. Academia is very, sort of a tough spot. It's not easy to break into academia, and I don't have the pedigree to be a law professor. I am a graduate of Georgia State University Law School, but I had a very strong drive, and once I want something, I sort of have this laser focus on making sure that happens. And so I wasn't going to give up, but I was also very strategic, and I took a lot of chances on positions that I knew wouldn't be long-term. I hoped wouldn't be long-term. They were not necessarily something that I saw myself doing for the rest of my career, but I thought would position me well to get the teaching job that I wanted. And so that was sort of, my story, and the risks that I took paid off. I can't say that that's everybody's story. but I also know that if you don't take risks, it's going to be hard to really get where you want to go.
That really resonated with me because that's one of the things that I think about and talk about a lot is just the trying things, because I think people they want something or they want a directional thing and they get immobilized and I don't know how to get there. And really, if you just start, I loved that I started volunteering for things. I was trying this, I was trying that. You end up sort of getting affirmation in the direction that should be right for you. So that's why I really liked the way that you talked about that. It was very action focused. Okay, so I wanted to kind of establish your background and how you got to where you are. But can we focus on, will you talk about your position now, what you do, and give us more details about the Health Law Partnership? Absolutely. And how it works?
Yeah. Awesome. So the Health Law Partnership, as Michelle mentioned, is a partnership between Atlanta Legal Aid Society, Children's Healthcare of Atlanta, and the Georgia State University College of Law. And the mission is fourfold, basically. So we want to provide, a comprehensive set of free, direct public health legal services that address, a full spectrum of social, economic, and environmental factors that affect low-income children's health and well-being. We want to promote that sort of interdisciplinary education between the healthcare field, legal professionals, and other professionals, social work, public health, bioethics, to work as a team to improve the health of children, and especially children from underserved or vulnerable communities. We also, thirdly, want to recognize and address systemic policy issues to the extent that we become aware of them through our individual work. And then lastly, we also engage in evaluation, research, and scholarship that's designed to specifically improve service delivery, and also to establish HELP as a model medical legal partnership. And so I know you probably want me to talk about what a medical legal partnership is.
Maybe just mention it.
Okay, so a medical legal partnership is basically a collaboration between medicine and law, which includes legal professionals on the healthcare team, so that we can improve the health and well-being of patients. And so the lawyer's role is to address those health harming legal needs that patients may have. And so the classic example that we use is, imagine a child who has severe asthma, doctor prescribes medication, child continues to have these acute episodes, is in and out of the emergency departments. The doctor says, are you taking the medication that I've prescribed you? Mom, child is saying, yes, we're adherent with the prescription, and the doctor's at a loss. All of the medical tools that I have at my disposal, I've been dispensing, and yet this child is still continuing to come into the emergency department with these acute episodes. If the doctor has been trained in medical legal partnerships, that doctor might ask him or herself, what's going on in the child's environment? Is there something that I'm missing, something that, as a medical professional, I don't have the expertise to handle, but somebody else does? And so if there's a medical legal partnership, that doctor, that healthcare professional will be able to make a referral to the legal team. And then the legal team will contact the family, will talk to the parents to do a legal checkup, to find out what's going on with the family, to find out what issues might be happening. And in this scenario, the legal team might find out, well, the apartment's run down. The landlord won't fix the ventilation system, and so we have mold growing. There might be some type of insect or rodent infestation, which is exacerbating the asthma. And until those things get fixed, and until those things get remedied, this child is going to continue to experience these, negative health outcomes. And so that's just the sort of the classic example of the medical team and the legal team working together to ameliorate some of the environmental conditions or the legal issues that might be impacting a child's health.
So for somebody with a sociology background who didn't want to or didn't necessarily think about touching health, this is kind of the perfect position for you.
Yeah, exactly. Funny how that works.
It really is, yeah. I mentioned this, but I had this experience in 2020 of discovering all these amazing things that old friends were doing. And because you've been in this job maybe like a year now, when I saw that was your new job, I thought, amazing. So that's when I thought about seeing if I could finagle you to talk to me. So thank you. I want to talk now, kind of diving deep into the program, about some of the examples of the aha moments that maybe you or students have had, and how you've seen that kind of pairing of law students and medical students working, because I like anything that's about systems thinking, and I think this is just a lovely example of working with the whole system.
Yeah, so let me just, before I answer that question, let me just explain a little bit about how our partnership works with the medical students.
Perfect.
In addition to the law students who enroll for credit, we also have both medical students from Morehouse School of Medicine and Emory, as well as residents join us either for their elective rotation, law and medicine. There's a law and medicine elective for medical students, or residents can do their rotation with us. And so right now we actually have 3 fourth-year medical students with us and 2 residents. So we definitely have a full house. But the law students are assigned cases. And the medical students work directly with the law students on those cases. Most of the cases that we handle from the law school side are Social Security, income cases, SSI cases, housing cases, education cases. So those are the 3 main types of cases that we deal with. But the law students and the medical students are working together. They're learning from each other before they're in practice, so in this educational environment, which is intended to, and I think it does a pretty good job of sort of normalizing that medical legal interactions for law students and medical students. And then another really great aspect is that we teach a series of classes, joint classes with Morehouse School of Medicine, 3rd-year medical students, which is called the Fundamentals of Medicine. And so that's another really great opportunity to get law students and medical students in the same room, talking about interprofessional collaboration between the professions and the opportunities for improved patient and client outcomes. One of my favorite classes that we do is a jargon exercise, and this is leading up to my answer to your question, my actual answer to your question. But we do this jargon exercise where we put the different students in groups. So the law students are in a group and the medical students are in a group, and they come up with sentences that uses their professional jargon. And then they read it to the other professional group, and they have to try to figure out what the other group just said. And so it's really fun, and it's pretty funny, and it's a great way to just sort of, talk about the language. And I think language is so important. One of the things, and so here's the answer to your actual question. One of the things that has struck me about what sort of the interprofessional collaboration between law students and medical students can have, and how that might affect systems as we move forward, is that a lot of the medical students talk about how valuable this was because they never realized the impact of the language that they use in documenting patient charts, and how that could impact other areas. So for instance, with Social Security benefits, legal regulations, there's standards that have to be met. And medical students understand how to document things in a certain way by going through the law classes with the law students and seeing that if they write, patient is stable, for example, in their medical chart, a judge who's reading that, or a judge who hears that, is thinking, oh, well, this child is fine, or this patient is fine. And that's not necessarily what that means or what was intended by that doctor putting patient as stable in that medical record. And it's really interesting because we have case rounds classes every other week where we invite the medical director of health, and we have a former retired administrative law judge, and the medical students and the residents are there. And the medical director was stressing to the medical students in the case round session last week just how important language is in documenting. And sometimes, when we can use more words to really intentionally describe what is going on with the patient, as opposed to relying on vocation or profession specific language that could be misinterpreted outside of that profession, that's something that we really need to work on.
I think that jargon exercise is something that everyone should do, regardless of what their discipline is, because I was thinking I really want to be in that. That's excellent.
Yeah.
Yeah. Sometimes when you realize you've said something that's been completely misinterpreted, it's a little shocking. And then you realize the echo chamber that you speak in all the time.
Yeah.
So you also talked about kind of emotions and how students, when they're dealing with cases, I'm going to probably say the thing that maybe some of us have been thinking, but I don't necessarily often think of lawyers as emotional. And so, and I mean that with great respect, but the way that you talked about the kind of some of the aha moments around impacting people's lives and what that actually meant and how fulfilling that was, I thought was really important to talk about. So if you would share that, I would love it.
Yeah, law students really, some of the law students take our clinical class because they want to make an impact in people's lives. And I think for those students, they do have an understanding of the fact that there might be some emotional challenge. Some students take our clinic because it's an opportunity for them to gain practice experience. And so that's sort of the motivating factor. And I think it's those students who are much more surprised at the emotional toll that representing individual clients can have. I think, by and large, law students want to feel like they're doing something positive for people. That's why they went to law school. And we spend a lot of time talking about the law's ability to make a huge impact in a family's life. But I think, and maybe it's something that's similar to my ability to really get something is when I actually do it. I see that in the clinic as well, where I'm talking to students and they're saying, wow, this is really hard. I didn't really realize how emotionally taxing this was going to be, or how much this was really going to impact me. I find myself thinking about it a lot at night and worrying about things. I had a group of students last semester who had a hearing before an administrative law judge to get Social Security benefits for a family. And it wasn't a great case. And one of the things we stress in the clinic also is that you don't get to choose your evidence. A lot of times, you have a case that isn't the case that you wish that you had, but you do the best with with what you have. And so the students were feeling they really wanted to help this family, but they were feeling very frustrated because they were worried that it wasn't going to be enough, that, you know, they couldn't find the evidence that they needed to get the remedy that they were looking for. And what ended up happening in that case, I was actually a little bit surprised myself, was that we prevailed. And when the students called the client to let her know that the judge actually ruled in our favor, and this was a client who was very hard to get in touch with, was not cooperative. The students and I had many conversations about, you know, when clients aren't always going to help you, help them, and you have a duty to do the best you can anyway. And so when they called her, I think they were sort of expecting her to be like, oh, thanks, and not very appreciative. But the students said they could, even though they were talking to her on the phone, they could feel the smile in her voice. And it was the first time that they really could sort of hear relief and genuine joy in this client's voice. And it just really made an impact on them. And I think, you know, that's the type of experience that students get in the clinic. And I don't know that they're entirely prepared for it, but I think it's a really, really important experience for them to have in terms of their professional development and moving from the law school setting into the practice setting.
I love that story. I'm going to take a minute because I'm being conscious of time, but I want to follow that up. But if you have questions, put them in the chat and I will look and Diego will help me. So with that, Brooke, as you were telling that story, I go back to you saying, you know, you don't have, you know, the pedigree to be a professor and kind of the way you talked about that. But as I think about your background and the even your understanding of I needed to stay in the courtroom to stay kind of, I'm leaping here, but attached to the emotional impact that this work can have. But I also want to be able to touch policy because I want to, you know, be able to have widespread impact. What comes to mind to me is pedigree doesn't get you that, but having the sort of range of experiences and understanding that you have is probably perfect for that particular professorship. So as you were, maybe this is just a gentle nudge for you as a friend. It seems like when you say you don't have the pedigree for that, it seems like you have the perfect pedigree for that. I don't know if that's a question necessarily, but just an observation.
Thank you.
You're welcome. The other thing, one thing, you know, just as we were talking, I ask you just because I'm kind of fascinated by this right now, like, what did you learn from 2020? And you had a great story that I think is maybe for a series that's about the intersection of things and that sort of conflict at the intersection, pushing what I call innovation, but pushing kind of movement. This story makes me think that that's probably accurate. So I would love for you to kind of finish off with thinking, you're talking about kind of what some of the stuff that you were thinking about in 2020 and learning.
Yeah, so we are a mini law firm in a law school, basically. That work has always been in person. We meet with clients in person, we exchange documents, we sign documents, we go to hearings in person. So much of our world is traditionally in person, like so many other professions as well. But obviously, like other professions, we had to stop and pivot and figure out, you know, how do we connect clients and provide the same level of service when we're not in person, which is challenging. Also, we work with students, and so helping students in their professional development at the same time. But I was really impressed with people's willingness and their comfort level of figuring out how to modify our process to get the work done. And maybe that is also a testament to the students and just, you know, their excitement about the work. And they're a little younger than me, and so maybe they you know aren't as overwhelmed by the thought of doing everything virtually. But there was a student team last semester, and the client actually didn't have access to technology, but we had to get paperwork signed, and there were filing deadlines, and the students figured out on their own a way to, you know, safely have the client sign the paperwork. They took the paperwork to the client's house. They let the client know when they were there. They put the paperwork actually on the trunk of a car, and everybody used their own pen, and then they, you know, walked away, and the client signed, and then the client walked away, and then the students went and got the paperwork. And so, you know, that whole dance that they did with, you know, the familiar dance that we're all doing these days, contactless contact, basically. And I'm hoping that we're learning, and, you know, this is such a cliche, but we talk about necessity being the mother of invention. And I really hope that by the time, you know, things start to get more back to normal, we're not all so exhausted that we just go back to the old way of doing things and thinking about things, because that would just be such a shame, I think. What I've realized is that in a lot of ways, the exchange of information through electronic means probably is really great for clients, to the extent that they have the ability to do that, because a lot of our clients are single mothers, working mothers who can't miss work, sometimes are missing or are working multiple jobs. If we ask them to come down to Georgia State, they have to park, they have to, you know, a lot of times they have to take a full day off of work just to come down and sign paperwork, which they can't always afford to do. And so I have been really thinking about ways to continue to do the innovative things that we've been forced to do in 2020 as best practices moving forward.
When it makes me think about that idea of, if you can, you know, if somebody has to take off work to come down and in person sign things, if you can mitigate that by allowing new processes to happen, and then, as we talked about earlier, over, you know, all of your clients, the collective impact of all of these lost days of work not happening, you actually start to have like a pretty big impact. And it goes right into the conversation you and I had about how do you measure impact in a program like yours? Like, are you actually impacting people's lives? And measuring, you know, is very tough. We laughed and brainstormed a little bit about it, but if you really start thinking about, there are all these different touch points, and thinking about how to redo them in a way that helps you impact people's lives positively. So to me, it opens up this whole kind of fascinating area. That wasn't a great question, sorry.
No, I mean, I 100% agree. I think, like I said, I think it would be a shame if we just went back to business as usual after we get back to some semblance of normal. One of my biggest pet peeves is when you go into a new situation and you say, well, why are you doing it this way? And they say, oh, well, that's just the way we've always done it. That, when I hear that answer, that just, you know, is like nails on a chalkboard for me. And I you know, I have a bias about that, but I really hope that it, you know, we take this opportunity to do better. When we know better, we should do better. And I think that when we really stop and take a moment to reflect on 2020 and the ways that 2020 forced us to think differently, to think more creatively, we're going to find that there's a lot of wisdom in that. And there's also a lot of work to do. There's a lot of work to do. And so, no rest for the weary.
Well, didn't you have 4 things, like kind of 4 pillars of the health law partnership? You might now have the 5th one, which is like innovation in legal practice.
There you go.
Yeah. I actually had a question that came into my mind. Is like, as you talk about the impact and how the program works, and the amazing work that you guys have been able to develop, I was wondering, like in 2020 and 2019, when this whole pandemic thing was starting, like how much of like the professionals out there, both in the medical and the law fields, have approached you guys trying to look for new answers, new initiatives, new ways of thinking that could really help them to support each individual, whether it's in the legal aspect or the medical aspect. So I don't know if you can talk a little bit about that. I think that's very interesting.
Yeah, no, that's a great question. And I think that, honestly, Diego, we haven't had a lot of people reach out to us. I don't know. I have some of my colleagues from Atlanta Legal Aid who are here today. I don't know if they, other partners within the Health Law Partnership have gotten those types of questions. In the law school clinic, we certainly haven't, from the outside world. In the clinic, one of the things that we don't just represent clients, we also have a classroom component, like other traditional law school classes. And I think because of, clinical education is a little bit different than doctrinal legal classes. And so we are a little bit more innovative just anyway in the ways that we do things, in the ways that we deliver education. And so colleagues within the law school setting certainly have reached out to us, sort of tap into some of those ways of reaching students. In our advisory council meetings of the Health Law Partnership, we're constantly talking about how do we sort of scale what we've been doing further? How do we learn from what we've been doing and then, scale it for the future? And how the Health Law Partnership was a really innovative model of medical legal partnerships. It was the first medical legal partnership in the Southeast. It's about 12 years old now. And it served as a model throughout the country for other medical legal partnerships, as well as internationally. One of the other professors in the partnership frequently lectures internationally to other folks who want to start a medical legal partnership. And so we're, thinking about ways that we can, stay innovative and stay, at the front of the line so that we can continue to serve as a model and we can continue to advise other people on the lessons that we've learned.
Thank you. Does anyone else have questions? Diego, that was a good question.
Thanks. Yeah, no, I've been following there's one from Lyris. Can you share a success story of a student/client partnership that you have had?
Yeah, so in full disclosure, this is only my second semester in the clinic. So I'll share the success story. I'll just sort of build on the success story that I referred to earlier. And I'm hoping I have a couple of candidates for success stories that we're working on currently this semester too, but they're not they're not finished yet, so I can't claim them as a success yet, but I'm hopeful. So as I mentioned, this was a case where a child had been denied for Social Security income. He had a very low IQ. He had problems processing information, didn't do well in school, was falling far behind in school, and had a hard time relating to his peers. But he had been denied for Social Security disability income. And one of the, so we do, just sort of to give you an understanding of the process that we go through when we have a case that's going before a hearing, we provide a lot of opportunities for students to sort of practice in a non-real setting. And so we have case round sessions where we get the input from the medical professionals. We have a retired administrative law judge that provides input, and as well as lawyers from the field. And so we got, we were feeling a little bit frustrated because we weren't seeing that it exactly fit within the standards put out by the Social Security Administration. But during that case rounds process, one of the folks that was participating said, have you ever thought about looking at how many standard deviations below the norm this child is in the various standardized tests that this child has taken, and using that as a way to sort of show how far behind this child is academically and how much this child struggles. And so we were able to work with one of our medical students who was joining us at the time, who put together this really great chart, went through all of the evaluations, the psychological evaluation, all of the standardized education evaluations that were within this child's school records, and made a chart of how many standard deviations for each individual evaluation and each individual component of each evaluation this child was. And it ended up, when you could sort of see that visual, it really was impactful. And so the students were then able to take that visual and to take that chart and to use it in their legal advocacy. And I can tell you that when the judge was very excited that we had students, and apparently she told us she was a former teacher, and so she was complimenting the students. But one of the things that she said to the students was that they had done a really great job in articulating through the use of the visuals and using the language of the standard deviations to explain why and how this child was so far behind, to the extent that it was considered a disabling condition. And so to me, that was a success story on a lot of different levels. The sort of the most impactful for me was it showed that interdisciplinary collaboration, and it really showed the medical professional and the law students working together to be able to provide the best evidence we could in this case, and it ended up working. And so I think that's one of the success stories that has been really impactful for me in my short time in this particular job.
Brooke, Megan, thank you so much. That was a fantastic discussion. I wrote down several little points for myself, and I really appreciate you sharing your time and knowledge with us today. On behalf of the Rollins School of Public Health and Orange Sparkle Ball, I want to thank everyone for joining our session today. As Diego said, we'd love your feedback, so please do take a moment to share your thoughts via the survey posted in the chat with us. For those of you who are able to remain online with us for the next 30 minutes or so, I do invite you to join us for our networking portion of the session. We'll break out into smaller rooms and have some good conversation. But before we do that, I want to let you know that our next session will be on March 16th. And our topic for next month is public-private partnerships. So really continuing on this conversation of how partnerships can be really beneficial in moving public health initiatives forward. Please mark your calendars, spread the word. Everyone is invited, the more the merrier, and we certainly hope to see each and every one of you come back and join us again next month. So with that, I'm going to let Diego send us into some breakout rooms for some networking. Thank you all again.